Public health officials in Tennessee are ending all vaccine outreach efforts targeting adolescents. That's not just for vaccines that aim to prevent the spread of coronavirus, but for all diseases. According to internal reports and agency emails obtained by the Tennessean, the state's health commissioner, Dr. Lisa Piercy, made the decision under pressure from conservative Republican state lawmakers. Going forward, there will be no more COVID-19 vaccine events on school property. If the health department must issue any information about vaccines, staff has been instructed to remove the agency's logo from all documents. White House Press Secretary Jen Psaki responded to the news at Wednesday's press briefing.
We continue to see young people hit by the virus as we've vaccinated so many of our elderly and most vulnerable. And we've been crystal clear that we stand against any effort that would politicize our country's pandemic response and recovery from COVID-19. So even as we've seen, unfortunately, personnel decisions made in other parts of the country as well over the past several months along these lines, we are going to continue to work with partners in states like Tennessee and in states across the country to ensure that we are pushing back against misinformation, that we are conveying accurately that the vast majority, 99.5% of people who are going to hospitals are not vaccinated, and ensuring we're using every tool at our disposal.
The state's efforts to dial down the vaccine outreach comes as the rate of positive COVID tests more than quadrupled over the past 2 weeks. That's driven by an uptick in cases of the highly contagious Delta variant. So far, just 38% of the state is fully vaccinated. For more, let's bring in Amber D'Souza. She's a professor of epidemiology at the Johns Hopkins Bloomberg School of Public Health. Amber, welcome. Thank you so much for being with us. So what's happening in Tennessee is not unique. Politics seems to increasingly influence policy. From a public health standpoint, how effective are these sorts of teen-oriented vaccination outreach efforts?
Yeah, it's really worrying to see politics getting in the way of science here. We know that the way to get people vaccinated is to get the word out, to communicate about its efficacy and utility, and to make it free and available easily. So these efforts on behalf of the health department are part of that important effort that people not just know about the vaccine, but have easy access. So any barrier we put in that way decreases opportunities for vaccination, which is really concerning.
You know, and there's so much attention now on how this is affecting young people and children in particular. In Mississippi, state health officials announced 7 children are now hospitalized due to COVID-19. 2 of them are on life support. What more are we learning about the Delta variant's impact on younger people?
Well, we continue to learn more. And what we've seen all along is that although this disease, COVID-19, absolutely does affect older people more severely, that doesn't mean it doesn't affect younger people. So the risk is lower, but the risk is there. And as we've done a good job getting vaccination among our oldest individuals, we continue to see younger individuals remain at risk, and we're seeing more and more young people become infected and, of course, then end up in the hospital. So it's very concerning.
You know, Amber, I'm sure you heard as well the numerous warnings about the approach of the Delta variant when it was first sort of becoming apparent in other parts of the world that it was so contagious. What do the data show in this country about how the Delta variant is spreading?
The Delta variant has quickly outpaced the other variants of SARS coronavirus 2, the viruses that causes COVID-19. It's the same virus, but the mutations that it has makes it more transmissible. So on average, each infected person is infecting more people. And that's why it is making it harder and harder to decrease the spread of this infection. And it is becoming the dominant form in the US. There's also some initial data that infection with the Delta strain may lead to worse outcomes. So it may make you more sick. But we're still collecting data to understand that part. But we do know that it is clearly more infectious.
So despite a doubling of COVID cases since late June, the country continues to reopen. Amber, do you anticipate that might need to change?
Gosh, we hope not. It's not too late to turn this around, but it's really unclear. Rates came down tremendously in the spring with successful vaccination and other efforts. We do have rates that are the lowest that they've been during the pandemic, but unfortunately, what we've seen just over the past few weeks is that has really turned around, and we're starting to see cases rise dramatically. And so right now, the rate of infection isn't very high, but the trend that we see is really worrying that we could in a few weeks be back in a situation of beginning to see really high rates if we don't turn this around, which we can still do. And so whether or not we ever need to impose additional restrictions is really dependent on what happens with infection. And we're not there yet. But if we don't do something to turn around these increases, then we can be back seeing real outbreaks.
All right, Amber D'Souza. Amber, thank you very much for your time.
Thank you.